everyone, this is Dr. Aditi Agarwal, a physiotherapist, and today we are talking about osteoarthritis. The osteoarthritis meaning like osteo is used for bone, arth used for joint, and art is used for inflammation. Before going to the topic, I have one question for you. Have you seen an elder person who is climbing a stair and having pain? This type of condition or this type of situation, the patient having the osteoarthritis. Now in this picture you can see there is this side a healthy joint and this side the degenerated joint. There is a hyaline cartilage in this joint which is in good condition. Then you have the good friction free movement. If the hyaline cartilage degenerate, you have the difficulty in movement because the hyaline cartilage is used in your joint function. Now we are talking about next part. In osteoarthritis, the osteoarthritis is the most common type of arthritis. You can see there is a wear and tear occur in this joint. Now osteoarthritis is a degenerative joint disorder which occur like the characteristic of the osteoarthritis: degeneration of hyaline cartilage and bone erosion and osteophyte formation in this type of condition, and patient complaining pain, stiffness, crepitus. One study conducted on osteoarthritis that shows 28% of cases having osteoarthritis in knee. The next part, the causes of osteoarthritis. There are lots of causes. There is not a single one cause. So the most causes are age. Age is a very risk factor, high risk factor. Then the obesity, injury, genetics, and muscle conditions or other disease. Now the next part. In the age, the person getting older, the joint also getting older. The person in the joint use is increased day by day, wear and tear occur in the joints. Now the obesity, the person gaining the weight which directly goes on your hip and the knee joint. Like if a person gain the 1 or 2 pound, it's divide like 6% on your hip joint and 3% on your knee joint. This is the major risk factor, you can say. Then the injury, if a person using repetitively the joint or athlete using the joint, there is a cause of osteoarthritis. The genetics plays an important role of the osteoarthritis. If a person of having the osteoarthritis, their children also having the osteoarthritis. The muscle weakness is there. If a person using their muscle and older, the muscle weakness is also there. The other disease like rheumatoid arthritis also cause the osteoarthritis and many more disease. Now we are talking about the clinical features. First, the patient complaining you pain. Then the crepitus is there. The third point is muscle stiffness is there and joint stiffness is there. And the person having the stiffness which is lasting for 30 minutes in the morning. As you work, like as you do the activity, the pain is also increased, the stiffness is also increased. As a person rests, the activity is stopped, then the patient decrease the pain. So the next point is clinical diagnosis. For the clinical diagnosis, you can just take a patient long history. A patient came to you, you can just take a long history of the patient like clinical examination. If a patient complaining a pain, you can check in which part they are having pain, right or left, and which number, like you can use NPRS scale for the pain. Then the morning stiffness is usually there. They have this complaint. Symptoms like crepitus, swelling, redness, reduced range of motion, difficulty in motion, and the mostly patient complaining if they are sitting in a cross sitting, they have difficulty in standing. In the physical examination, you have to observe when the patient came to you directly. From the door, you have to observe the patient, how they are walking. Like if they enter in your clinic, the posture you have to observe. Then the deformity, palpate the joint line, tenderness, crepitus, and assessment of the knee range of motion. You can use a goniometer for that. Muscle strength you have to assess by the MMT you can use. Evaluation of the gait pattern is very important in this kind of condition. The next, radiological examination, that play an important role in this type of condition. In X-ray you can see you easily see actually a joint space is reduced sometimes. There is a swelling, narrowing of the joint space, and formation of the osteophyte. Subchondral sclerosis is there, subchondral cyst is there, and joint deformity in the advanced stage. In physiotherapy management part, which is very important for us as a physiotherapist, we have to plan a treatment for different like what patient need. We set the treatment goal according to the patient need. First, the reduction in pain, improve joint mobility, increase muscle strength, improve balance and gait, enhance functional independence, and improve quality of life. Patient education is very important. Like you have to teach the patient disease, educate about the disease. Weight management, you have to teach the patient. Joint protection, how can they protect their joint. Activity modification, lifestyle modification, you can teach. In pain management, much heat pack you can provide the patient. Then the electrotherapy came here, the TENS, IFT you can give for pain relief. Cryotherapy you can use in acute stage. Then the therapeutic part come, like different kind of exercise you can give to the patient. Like for the range of motion, you give the heel slide, knee flexion extension exercises. Then the stretching exercise, which is also very important, like hamstring, quadriceps, calf muscles. After then, the strengthening exercise play a major role because there is a weakness of the muscles in osteoarthritis. In advanced rehab, you have to teach the patient functional training like balance training, gait training, proprioception training, aerobic exercise, walking, cycling, aquatic exercise. In manual therapy, you can apply the mobilization like patellar mobilization, tibiofemoral mobilization. Mobilization work on pain and the range also. And the soft tissue technique you can use like MFR you can use, DTFM you can use, PRT you can use. And then the home exercise program came, like daily range of motion exercise. Whatever you like need for the patient, you can treat the plan according to the need of the patient. That's it. Thank you.